Started. Just a little bit about me, a couple of disclosures. I'm currently a doctoral candidate at Baylor University School of Education, and my dissertation research is on the pre-service preparation of EMS educators. Speaking of, I would like to thank NAMSI for assisting me in distributing the link for my initial survey for my research. But today's presentation is predominantly the background to my research and does not reflect the views of NAMSI or Baylor University. I'm also listed as a reviewer for the most recent Foundations of Education book written by NAMSI and published by Jones and Bartlett Learning. Speaking of, I'm also employed by Jones and Bartlett Learning. And while I have affiliations with all of these organizations, none of these organizations are being represented in anything I discuss today. The opinions are mine and research-based, but certainly not reflection of anybody I'm affiliated with. My background includes over 20 years teaching in EMS and over 15 years teaching. And we're here today because about 15 plus years ago, I woke up one day and decided that I wanted to teach EMS and nobody stopped me. So that's sort of a kind of a teaser as to where we're going. But I always like to know a little bit about who I'm presenting to. And so we've got a poll up there. I'm just sort of curious how long the people on this webinar have been educators. All right, so a nice variety. For those of you out there that started when dinosaurs roamed the earth, I feel like I'm quickly approaching that, but I'm not quite there. And I think that what we're going to see as we talk a little bit about the pre-service preparation is those of you that are out there with a year or less or 1 to 5 years might have very different experiences than those of us that started 15, 20 plus years ago. So what we're going to talk about today is why teacher preparation matters, what the research says about teacher development, characteristics of quality educators, and why we should care. And while that's what I plan on covering, I'd love for people to put in the chat what you're hoping to get out of the presentation today. I really appreciate interaction, and I'm sure you all know as educators, it can be challenging to do these things online. So don't hesitate to put things in the chat or ask questions so that I feel like I'm not just talking to a blank screen out there. So interestingly enough, this is the exact quote I used to start off my dissertation. Many, if not all of you, have likely heard this adage, he who can does, he who cannot teaches. And I suspect that many of you, including myself, have even made this comment at some point in jest, right? Like he who can does, and therefore I'm in here teaching. The reality is sometimes that is actually how people end up becoming educators. They get injured, they're on light duty, there's just nobody else, and they're sort of picked out as the next person to teach. For those of you that don't know, this quote is actually from a 1905 play by George Bernard Shaw called Man and Superman, which was in fact a comedy. So if you've been joking about it, that's not totally inappropriate. What you may not know is that this quote is actually considered a stereotype threat, which is a type of situational threat that actually diminishes performance because of a negative stereotype about one's own social group. So there is research to show that this mentality actually hurts our performance as educators. And believe it or not, we're doing ourselves harm when we make this kind of joke, because negative teacher stereotypes actually reduce the attractiveness of teaching as a profession and may discourage really good providers from choosing a career path that goes into teaching. But why this really matters. Nelson Mandela said, education is the most powerful weapon we can use to change the world. Um, Most post-secondary educators in the United States are not adequately prepared to teach. This is not specific to EMS. This issue spans across most post-secondary education. You can look at nursing literature, you can look at medicine, pick any trade anywhere, law, anything you can think of. Essentially what we say is, oh, you did this, you should go teach this. So these issues that we have as educators are not unique to us. But what we know is that educators' preparedness, effectiveness, and retention are significantly better for educators who receive proper pre-service preparation when compared with educators that receive less or no preparation before teaching. We know that educator preparation encourages more of a student-focused orientation, and that improves learning outcomes. And so the research shows that not only does teacher preparation improve teacher preparedness, effectiveness, retention of our educators, but it has a direct benefit to students as well. Alternatively, the lack of preparation impacts the self-efficacy and confidence of educators and managing the classroom specifically. There have been studies that have shown that educators that aren't as prepared may have high self-efficacy in content and curriculum, but lower self-confidence in managing the learning environment. There actually was a study done by NAMSI in 2005, and I'm happy to share any of this research if you're curious. They surveyed educators all over the United States and found that about 85% of us were very comfortable with the subject matter. But there were nearly, I think, a third to 2/3 of our educators weren't comfortable with managing the classroom itself. So this includes things like being able to adapt your lesson plans or your curriculum based on test results, giving feedback, or even classroom behavior issues. So while we knew what we were doing as providers, we weren't really that comfortable managing the classroom itself. Lots of research has shown that quality education requires quality educators, but in EMS, the current approach still relies heavily on this concept that a good clinician is a good teacher. And just because somebody's a good practitioner does not necessarily mean they're going to be a good educator. Historically, EMS educators have lacked standardization or expectations of experiences or even training to prepare new EMS providers in education for emergency medical services. To establish a set of professional requirements for educators, the National Association of EMS Educators, the Department of Transportation, Department of Health and Human Services, all collaborated to develop the 2002 National Guidelines for Educating EMS Instructors. So this is the most recent set of guidelines we have. It's 20 years old. But the purpose of these guidelines was to create standards for entry into the profession of EMS education. These guidelines stated that EMS educators should have a standard body of knowledge, including adult learning and motivation theories, curriculum design, and teaching methods. However, there's no requirement in EMS education for any educators to adopt these standards. I did this talk last week at EMS Pro, and I kind of surveyed the room and said, how many people have even read these standards for the instructors? And there was sort of like this tentative, I know they exist, but I honestly haven't read them. So EMS educators really lack standardization or expectations of experiences to prepare new EMS providers in education. And so due to this lack of pre-service preparation, much of the learning on how to teach EMS occurs on the job. So what we do have is, again, it's sort of the basic building blocks, but if we think EMS is a new profession, EMS education is even newer. So we've got our 2002 national guidelines. We do have the national EMS education standards, but they don't really prepare us to be educators. That's really designed to tell us what we need to cover in our courses. The Foundations of Education, I would say, is pretty much the only educator textbook geared toward EMS in the United States. And then, of course, we do have the National Association of EMS Educators, which is our professional organization, kind of lobbying for that. I do see a couple of things already dropped in the chat. Where can we find that study? Let me know which study you're referring to, because everything that I'm going to talk about today, I can send you tons and tons of links. If you're talking about the one that surveyed EMS educators, you should be able to find it online pretty easily. It's the state of, I think it's titled The State of EMS Educators in the United States, or it's the State of EMS Education in the United States. It's 2005. Joanne Friel was the primary author on it. But again, if it's another study you're referring to, just kind of let me know, and I'm happy to point you in any direction you need. Alrighty, so I want you guys to think back to the very first day you walked into a classroom. And I want you to tell me how you were prepared to teach. Okay, so this is sort of what I was expecting to see. I've spent a lot of time over the last year interviewing and talking to educators all over the United States. A state required instructor course kind of seems to be the route. Although honestly, the amount of people that said that they were not prepared at all is astounding. When I think of myself as an educator, I walked into nobody stopped me. I just walked in the classroom, not exactly just walked in, but I said I would like to teach. And in North Carolina, if you want to teach, now, if you're going to be a lead instructor, you do have to go through a methodology course. But to be an adjunct, you pretty much just say, I would like to teach, and they let you. We'll discuss why that may or may not be problematic. I see somebody said non-traditional alternative teaching licenses. That's fantastic, and we're gonna talk about that. Some of the other things that I heard as I was interviewing people across the country talked about things like they first took a CPR instructor course or one of those other kind of canned courses. So they had some very basic methodology, perhaps, but not a particularly lengthy course. So when we think about formal teacher development, we're talking about both pre-service and in-service development. So pre-service, traditional teacher preparation versus alternative. So I really appreciate the person that put that in the chat, this alternative preparation. I will say when I did this last week, I got a question right off the bat from the audience about what did I mean by pre-service? And that was a good reminder for me to kind of clarify for everybody out there. When we're talking about pre-service development in this presentation, I'm talking about the pre-service preparation of educators. And so I can see how this terminology would easily be confused with pre-service or initial provider education, but essentially it's the same concept. We wouldn't expect somebody to work as an EMT or a paramedic without first going through pre-service training. So why would we think it's okay for our educators? So the two predominant pre-service teacher preparation models are traditional alternative. And despite the fact that the general consensus in the research is that traditional teacher preparation prepares future educators better, the most recent study said that about a quarter of the educators in the United States were alternatively certified. I suspect if that study was redone today, we would see a drastic jump in that due to the amount of educators that left the field, especially with COVID, and there was sort of this pivot to figure out who could we bring on and how could we get them on board. So when we think about traditional teacher development, that's your kind of 4-year university style college level education. And for those of you that may have kids or at one point had kids in the US education system in the United States, I imagine that you would think to yourself, I would like for their teacher to have an education in education. But again, in the post-secondary setting, this doesn't cross anybody's mind. So we think it's really important for our K-12 educators to go through a really rigorous training program, but nobody thinks about that for post-secondary. In contrast, alternative teacher preparation programs are a route to teacher education that does not involve this 4-year education. A lot of these are work-based certifications. And there's a reasonable amount of research that says that our alternatively prepared educators are going to do just fine in the classroom because they have that strong background in the profession itself, and they bring those experiences in with them. Yep, may not work in the vocational tech education. You're absolutely right. So alternative preparation is typically what you're going to see more for our profession because most of us aren't going to go in and go get a 4-year degree and then say, you know what I would like to do? I'd like to go teach paramedics. We kind of back our way into education. So the second part to this is our formal in-service development. And I really want to spend a lot of time on this because what we have found is that in lieu of a really solid pre-service preparation program for EMS educators, a lot of what we get is on-the-job training. So I'd love for you guys to just sort of drop in the chat what you do for professional development. How do you better yourself as an educator? You're all here today, so that's something. Take these classes, yep. Ride time, I like that. Classes, reading, ER time. Oh, yay. Congratulations to the other EDD candidate. We should commiserate soon. My final dissertation has to be submitted November 20th. So if I look like I haven't slept in days, it's because I haven't slept in days. Watch experience educators. That's fantastic. Watch others in my facility. So you guys are kind of hitting on a lot of these main areas. And it's funny because before I went down this path, everything to me was professional development until I discovered that professional development, it really is its own category, even though I had been lumping everything into it. So again, because so few of us in post-secondary education, we don't really receive the type of pre-service preparation we really need. We utilize in-service models to kind of supplement our knowledge, both pedagogical and content knowledge. And somebody in there put in there that they do ride time, and that's really important. There's a lot of data out there about as educators, we need both pedagogical content, so we need to know how to teach, but we also need obviously subject matter content. So we need to know the content that we're teaching and we need to be confident in that. And part of how we do that, right, is staying clinically relevant, that we're still getting out there, we're still doing ride time, we're still seeing patients. And then there's also this concept of pedagogical content knowledge, which is that not only do you need to know the content to teach and how to teach, but how to teach specific content in specific ways. So it's pretty fascinating. So successful professional development is kind of like what we're doing now. So these are kind of typically your one-off classes, maybe 1 hour, 3 hours, and they happen every so often. This is what I have always thought of as professional development. And there's a lot of research that shows that professional development, when you define it by improved student outcomes, best improved student outcomes if professional development is based on teaching curriculum content in a way that students can understand. So how are we presenting this information? If it's based on managing student behavior, the ability to elicit student participation, and the ability to assess student understanding. So all of those are very kind of how do I do my job, pedagogical content strategies. Professional development that focuses exclusively on content knowledge doesn't really have an effect on student learning. So what we do for our professional development as providers has very little effect on your student learning outcomes. Recent research has found that really good professional development should match the educator's needs and match the school's needs, and most importantly, involve educators in the planning of these activities. And that is facilitated by high quality instructors. So again, I'm reading a lot of your answers, going out, going to conferences, watching other educators. I think I go to conferences and network and listen to people. And a lot of doing that is because I need to be out of my own area. I need to hear from people that aren't just my colleagues. I need to hear from people that aren't just the people I work with every day. So I need to go out into the world, into the big scary world, and hear not just what other people are saying, but how they present it. I take home new nuggets of information every single conference I attend. So really going out there and getting high quality professional development from high quality other educators is ideal. Professional learning communities, on the other hand, are educators who share knowledge and experiences and learning together. And I think this is a really fantastic model for professional development. While we know that professional development can improve student learning outcomes, there's a lot of research out there that shows this is actually the least effective model of teacher education. And the professional development really should be an ongoing process. So while we can learn in these conferences and we can learn in these one-off courses, and I certainly hope you learned something here today, what we find that's most effective to change educator behavior is something that is ongoing. Again, some of the research shows that it takes at least a year of training to actually improve and change teaching practices. And so shorter trainings, teachers aren't as sure of themselves. So imagine when active learning first became really popular, if you only took one 1 hour, 3 hour, whatever presentation on active learning, would you feel 100% confident going back to your classroom and attempting this? And for those of you that have only been teaching for a year and you don't remember being PowerPointed to death, like the rest of us, congratulations. But that's what we did for a really long time because we didn't know any better. And so we know that these professional learning communities allow for groups of educators to get together and learn things together. And it's very educator driven. So they're picking topics, maybe they're picking challenges they've had in their classrooms, they're reading journal articles, they're discussing it together. But this is kind of an ongoing process. Mentoring and peer coaching are often used interchangeably, but while similar, mentoring is really a process where a new teacher is mentored by an experienced educator and is much less reciprocal than peer coaching. So a mentor's purpose is to oversee a less experienced educator's professional development and career. And both the mentor and the mentee benefit from these relationships. I didn't see anybody in the chat, unless I missed it, mention mentoring. I definitely saw this idea of watching other educators, so that peer observation. But mentoring, I think, has a real potential in EMS education. It is a theme that I consistently heard again and again and again from educators as I was interviewing them. And I really think that that's a model that EMS should be considering as we think about how we better our education system. But again, the mentee and the mentor both benefit from this relationship. So the mentor can be a sounding board for the transition from practice to education. They help new educators implement curricula. They really just kind of help with those day-to-day, I haven't faced this before, how do you deal with behavior problems? This particular lecture flopped, how do I adapt it to online? Kind of those type of questions that new educators just haven't had to tackle yet. Alternately, mentors report feeling rejuvenated by helping shape others and increasing their confidence, and it's really personally fulfilling. I think Those of us that like to go out and speak at conferences, I know personally, I feel rejuvenated every single time I do a presentation, not just from the interaction with my colleagues and my peers, but I remember that I'm excited about education and I get the opportunity to stand up and teach and kind of get other people excited about it. And so it really is fulfilling for the mentor as well. From an organizational standpoint, mentoring increases retention and recruitment efforts. So brand new educators like having somebody to turn to that's not necessarily their direct supervisor. In Indiana, you have to student teach. That's amazing. I'd be curious to know how long you have to student teach with a mentor, because I think that's fantastic. Again, with the research that I've been doing, the standards across the United States are just so wildly different. Some places require practical time, some places don't, some places require absolutely nothing. Some places have different tiers of educators. We could talk, that's a whole nother research study in itself. I'm actually starting to tackle is just how different all of our requirements are. But I think it's fantastic that you have to teach with a mentor. Peer coaching, which is again a little different, is two educators that are engaged in more of a supportive relationship that's a little more collaborative. And it's really intended to improve the classroom and the classroom processes rather than a true evaluation of an instructor. And again, there's been tons of research as a benefit of both formal and informal peer coaching opportunities, including being able to give back, learning from each other, better problem solving abilities, and this sense of empowerment and creating new and innovative ways of teaching. Peer observation, however, is a much more evaluative process. And this is particularly the case when peer observation is part of a formative rather than summative process, and the observers are appropriately trained in peer observation. And so in this manner, and again, we're instead of just kind of a one-time year end, this is how you did, we know that a one-time snapshot really doesn't tell us much about learning, but sort of this formative over time peer observation can really be a benefit to educators, both new and experienced. New York, you have to intern for a full class before you get your CIC. Okay. Yeah, in North Carolina, you have to have 100 teaching hours before you can be a credentialed educator, but it doesn't necessarily have to be in an entire course. You do have to have a variety of topics, but I think it's fascinating to hear the differences. There are some states where you just need to say, I would like to be an educator, and you start teaching. So for your states and there are other states that have extremely rigorous processes. So please know that when I talk about all of this stuff, it kind of runs the gamut of how we do this. So informal teacher development is the type of development that we're learning occurs outside of the classroom and through our daily activities. And so it really typically falls into one of four categories. And I know somebody mentioned a reflective process in there and how they kind of work on their own development. And that's really, reflection is probably one of the bigger ones. So you think about, hey, this is how I did it. This is how I want to do it better. And that true reflective process of how your teaching skills are, how your classes went. I was talking before this presentation that I did this live and in person last week. And then I won't say I overhauled it, but I definitely made a lot of edits to it to make this more amenable to an online presentation. And every time I do something like this, I go back and I say, man, I wish I'd have said this. And oh, I could have done that better. And I wish the flow didn't work here. And so that reflective process is really important to improving yourself as an educator. Information seeking, and I definitely saw some of this in the chat. If you're reading books, if you're reading journal articles, if you're Googling, so information seeking is this idea that you're learning from others without any specific interaction. And I certainly know I Google things all the time, everything from how do I make this poll work in my presentation to what's the latest practice on motivation to kind of anything. I think one of the challenges we have as educators, if you're not affiliated with a college or a university, sometimes it can be harder to get your hands on those journals because the reality is journals often cost money. And so, how do we find these pathways? There's Jim's articles and NAMSI puts on webinars, and there's kind of all these other things that are out there. But information seeking is absolutely a way that you are developing your own profession. Experimenting, which a lot of people don't think about as professional development, but I'm sure, especially those of you that were here when the dinosaurs were roaming the earth, this is when you like throw something to the wall and see what sticks. But experimenting, this idea of let me see if this works in this classroom. Let me see if this is a good idea. I remember when we first moved to a flipped classroom in my college, there was a whole lot of there were some things that worked really well and there were some things that flopped horribly. And even then there were some things that worked really great with one class and did not work so well with another. So experimenting is a way that you're developing yourself professionally. And then the last kind of main informal type of learning is collaboration with others. So this is like a professional learning community, but it's not really organized by a school or a district. There's no preset times or assignments. But this is where I think a lot of us probably fall into. I certainly do. I have a group chat on my phone that sometimes is very active and sometimes I don't hear from for months. But I certainly know when COVID started, my phone blew up all day, every day with all of us trying to figure out how do we move all this stuff online? How do we make such a tactile profession be something that's all of a sudden remote? How are you teaching cardiology? How are you doing this? How are you doing that? And all of this kind of collaboration, but nothing was formalized. It was like, shoot it out there and see who answers. And I think that collaboration with others, and again, some of what we get at the conferences and at these meetings we go to doesn't necessarily happen in the classroom while the lecture is going on, but it happens in these side halls where you pull somebody aside and say, I love what you said in there, and I do that too, or I do it a little differently, or can we trade contact information? And your relationship grows from there because those relationships are huge. Yeah, it was definitely the Wild West of teaching during the pandemic. I agree. Some of us were more set up than others. It was something. I'll be very curious to see some of the longer term research on what this did to our learners. In the short term, it looks like, at least in EMS, we didn't do any real harm, which is fantastic. But when you look at a lot of the K-12 literature, there's going to be several years worth of teaching that got pretty significantly disrupted. And there's going to be a lot that our students are going to have to overcome. So researchers agree that teachers engaging in informal learning, this absolutely contributes to teacher education. And one of the main benefits to this is that it's not constrained by preset times. It allows educators to learn whatever they're interested in. And we know from all the research on professional development that professional development is most effective when it's something that the educator is specifically interested in and can utilize in their practice. It fills a gap in their knowledge. It's something that they need and or want to learn. So this informal learning, all that learning is driven by intrinsic motivation. We're just chatting and learning this on our own. So we know that there's a lot of benefit to informal learning. And there is some research that shows that there's a benefit to student learning outcomes based on informal learning. Now, some of the challenges of that is that it's informal, so it's really hard to measure. But we have seen some literature that shows that even these informal learning opportunities are a benefit to students because we're taking what we're learning, we're invested in what we're learning, and we're applying it to our classrooms. Yeah, I agree. So Susan says, I think we found from the didactic portion, there were some advantages to online lectures. There is. I did a study. It's not published, so if you go looking for it, you won't see it because I'm too lazy to do anything with it, to be honest. Actually, I'm also just trying to graduate. But I looked at student learning outcomes and I compared classrooms that considered themselves to be traditional versus hybrid and flipped. And then looked at test scores pre and post having to move online for COVID. We actually saw test scores going up in the traditional and hybrid classes. Those that identified as kind of flipped classrooms stayed the same. Obviously, we can't make any causal inferences to that, but there does seem to be a correlation to online lectures and online learning and student learning outcomes. So what that is and how we break that down, I don't know, because I didn't go that far, but I was really just curious, had we done any harm? So there is definitely research out there that shows that students actually, at least in the EMS profession, did okay with COVID. All right. So what makes a quality educator? We've talked about there's a need, right? Pre-service education makes you a better educator, whatever that means. In-service development makes you a better educator. But how do we measure quality education? How do we decide what makes you better? Interestingly enough, there was a huge meta-analysis done in 2015. There were more than 1,500 empirical studies on teacher preparation research. And the consensus and what it suggested was that teacher quality is the most critical factor in student learning. So we're kind of now walking our way toward, why should we care about this? Why should we care about teacher preparation? Why should we care about our in-service development? Because we know that quality teachers impact student education. Essentially, what you get in is what you're going to put out. However, there's not a consistent definition of a quality educator or teacher quality in the literature. This is just a tiny brief overall literature review. And I won't bore you guys with all the details, but essentially researchers tend to agree that quality teachers depend on the teacher inputs, like education, years of experience, and your pedagogical knowledge. However, the literature is pretty inconsistent in demonstrating how all the other characteristics impact teaching quality. So these are things like classroom readiness, personality traits, reflectiveness. So we know that some things matter, but other things we're just not so sure. And you can see, again, just from this brief review that I have up here, we've been studying this in education for at least 20 years now and don't have a consensus on what makes a quality educator. So I'm just kind of curious from the group, what characteristics do you guys think are important in a quality educator? What do you think they need to be effective? Patience, yep. Meeting students where they are. Oh, principles of andragogy. Effective communicator, patience, empathy. I love all of these. Student-centered, yep. Student population and their needs. Competent, yep. Being able to, making changes in the way you teach. And it's fascinating to me as I'm watching you guys, because if you look up here, I keep seeing empathy and passion. And with the exception of enthusiasm, you don't really see that on these list of things that we're researching. Because how do we measure that, right? How do we measure somebody's enthusiasm? Do we give them a scale of 1 to 10 and say, like, Leah came in very energetic today? So these are all these, it makes me think of how we should be evaluating the affective domain of our students, right? These is what we call soft skills that are actually quite important. These are so hard to measure in teacher efficacy. And so we've been measuring what we can measure. We're measuring things like, do you have a college degree? Do you have a college degree in education? Do you know pedagogical practices? Are you, let's see. I love the last study I listed is the only one that's really done a lot of kind of the personality traits. They actually tested, I believe, 7 different traits. The 3 I listed were the only ones that they found had an impact on student learning. But enthusiasm was one of them. So I think you guys are really onto it. We've got to be flexible. We've got to have passion. We've got to know our audience, but a lot of the other things that you're saying in here, things like, please don't mind the fact that I now have a cat on the back of my chair if you guys see my video, understanding student population and needs, willingness to kind of meet our students where they are. Whether or not you're aware, all of those are principles of andragogy. And that is something that we should all be learning as educators. And I will tell you that I certainly did not as I started as an educator. I started 15 plus years ago, and I believed that a rule was a rule and the deadlines were the deadlines. And I think back now to students that I probably failed because I didn't know any better, because I didn't really fully understand adult learning and adult learning principles. And in my brain, like they were here to be a paramedic and they should turn in their assignments. And if they can't, then they should get a 0. And I didn't really have a concept of like, wow, they have families and lives and tragedies and joys and a whole thing outside of this classroom. So I think a lot of what you guys are talking about, whether or not you have the terminology for it, you're dead on. And ultimately, again, and this is where I talk about how I got here, I decided to enroll as a doctoral student because I one day, again, woke up and thought, I don't know anything about teaching. And I felt very lucky that I stumbled across a lot of the right things, but not because I was ever prepared. And so I want to be very clear. I think we have amazing educators out there, but I think that we could have so many more amazing educators if we were appropriately preparing our educators before they ever start. All right, so how do we measure teacher effectiveness? How do we actually measure it? Feel free to drop in the chat. How do you know that you are an effective educator? And then I'll tell you what the literature says. Nobody knows how you're effective. Here we go. They're all popping in at once. Student outcomes, engagement, not stressed out. Embracing feedback, positive and negative. I love that. Post-class surveys. I think it's a fantastic idea. Would they actually, if they could actually use what you taught? Oh, the light bulb. Oh, when somebody finally gets it, that moment. Satisfaction, engagement. I think student satisfaction is a really fascinating topic. We do these surveys. If you work in a collegiate setting, then you're probably required to do some sort of post-course survey. And we do them, and we're like, did the student like you as a teacher? Did they feel like they got anything? And it's fascinating to me because the student can just rip you apart and still have an A. And so if your evaluation is just garbage, like I hated the instructor, I hated the course, I hated the content, she didn't know what she was talking about, blah, 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 the student gets an A, does that mean you were ineffective? I'm really sort of fascinated by the concept that we are using students' perceptions to decide whether or not we're effective. However, the flip side to that coin, right, is a one-time exam also a good measure of our teaching? Like, were we good because our student didn't do great on one exam? I could have been the best teacher in the world. Student just had a really bad testing day. Maybe they didn't sleep the night before, or maybe they were struggling to pay their bills, or maybe their kid was sick, or any number of things. So I think measurement in and of itself is pretty interesting. Student engagement, strengths and weaknesses, measure objectives at the beginning and look at them again at the end. So in the literature, typically when we talk specifically about post-secondary education, we measure teacher effectiveness by, and I quote a 2021 study by Martino, industry certification and the career certificate programs. Ta-da! I put up NREMT. For those of you that aren't NREMT states, you can supplement this with your state exam or whatever else. Right now, the best measure of adult learning when we're looking at these industry fields that we're in, like EMS, teacher effectiveness is measured by successfully passing your credentialing exam. Now, I think this has its challenges too, right? Because I can be a great teacher, and again, it could just be a bad testing day, whatever. But the reality is, again, especially if you guys are teaching at colleges, a lot of funding is tied to pass rates. And so I'm not saying this is the only measurement that I think that is out there, but I will tell you that this is the only one that's really in the literature right now for our field. And I think that's something to consider. So how do we know we're being effective? I prefer those softer things, the light bulbs, the engagement. Is my student getting something out of this? Are they asking thoughtful questions? But again, those are all hard things to measure. So here we get down to the nuts and bolts of it. Why should we care? So when I talk to people about my dissertation or my research, I explain it this way. In EMS, we look at somebody and we say, you are an amazing paramedic. You should go teach. And they do, or not, but oftentimes they do. We would never walk into a 5th grade classroom, look at a teacher and say, you are a fantastic educator. Go jump on the ambulance and work as a paramedic. We wouldn't do that because they are two different disciplines. And yet we continue to foster this idea that a good clinician is going to make a good educator. And we are putting educators out there to teach without appropriate preparation. It's a big, bold, scary statement, and it may not be talking about any single person on this webinar, but I can guarantee you it is happening. And that is the whole reason I did my dissertation, because there is exactly, my advisor I know would be cringing if she heard me say this because we've thought about this for the last 2 years. I have been able to find exactly one study on EMS educators in the United States, and that's the 2005 study done by NIMSY. One study. So we are not good in EMS about doing research anyway. We've got some reasonable education research. We're not looking at ourselves as educators. We're not looking at our needs. We're not looking at our strengths. We're not looking at our weaknesses. And so this is really what drove me to this. Teaching is the profession that creates all other professions. And we are doing a disservice both to our educators and to our students by not preparing our educators with what they need. So like I said, we know that post-secondary educators across the United States are not sufficiently trained to teach. As emergency medical services educators fall into this category, research supports the argument that they need better pre-service preparation. And so do I believe that every EMS educator needs to go the route of a 4-year degree in education? I do not. I don't necessarily think that's the way we need to go. But do I think we need to have more standardization and something better for educators? Absolutely. And I care because I am a product of the system. I care because one day I woke up, decided I wanted to teach, and nobody stopped me. Just a couple of highlights I want to point out kind of before I wrap this up. Again, because I have not defended, I'm only allowed to say these are my preliminary results, but these are 2 big takeaways that I've gotten out of my study. Many EMS educators across the United States feel that they were not prepared to teach, feel that when they walked into the classroom, they did not have the skills they needed. They also reflect back and said they didn't know what they didn't know, but many educators do not feel prepared to teach. Interestingly enough, many educators are motivated to go into teaching because they want to improve the quality of education. So there's a recognition that we need to do better. And this may be because they had a really great teacher of their own they saw, and they were like, man, I wish my paramedic class had been like that. Or maybe because they had a really great mentor, or maybe because they had a terrible course. But a lot of educators are motivated to go into this profession because they want to make it better. And I suspect you're all here today listening to this because you want to make it better. So a couple of what I like to call unpopular opinions. Cats are better than dogs. The office is overrated. Christmas is the worst holiday. You guys can read these. I really love The Earth is Flat. If you've never wanted to waste a couple hours of your life, definitely go go to a flat earther page because you can go down the rabbit hole for hours. But there's a lot of unpopular opinions out there. That said, my particular unpopular opinion is that we should not allow unprepared educators into the classroom. Not only are we not helping our students, but there is research out there that we are in fact doing harm. And so part of my research is going to be to advocate for something better for our educators. That said, what questions do you guys have? Thank you. Oh, and while I'm thinking about it, if anybody is kind of curious, wants any of my references, more detail about anything I've talked about, I've got 100 and something, 100 and something pages written of a dissertation. I'm happy well, I won't just pass it out, but let's see. How do you keep your program director from letting the unprepared staff to teach classes? I think that is a fantastic question. So unfortunately, as educators, that's a really challenging place, right? We've got people above us that ultimately make decisions. Part of what I plan to do with my research data is to get it out there for more people to consume. So I'm hoping to present this at places like an AEMSP and NEMSI next year and a Creticon and anywhere that will listen to me talk, because we've got the data to show that we've got to stop this practice. And I get it. I was the EMS coordinator at my college. I know our profession. I know our profession is desperate for more providers. I know that to have providers, you've got to have people teaching the courses. I know that this is not a change that's going to happen overnight, but there's a point where we have to realize that the product out is the product in. And so if we are just putting Joe Smith off the street to teach, then we're going to keep getting nothing but minimally qualified practitioners. So how do you keep your program director? Send them to me and let me talk about, I'll just bore them to sleep with my data and they'll forget to hire anybody. I think the best thing I can do is we continue being advocates. Hopefully we get backing from some of these national organizations that recognize that we are a profession. We need a career ladder. We need a path. You can go searching. You can't find a place. You can't find a degree program for EMS education. So if you want to go into education, maybe you can get like healthcare education-ish. But like I said, this is new even for nursing and for medicine. Let's see. Nice headshot. Ha! Thanks. Thanks, Kelly. That was EMS World the other year. Not a question, but I need to do better on educating. Yeah, we do. Definitely interested in reading results. So my plan is to actually publish it. Hopefully I'll defend between January and March, and then it'll get published sometime, I hope, next springish. But again, if you want me to come out and speak at conferences, let me know. I don't know where you guys are from, but I'm kind of around a lot of places. Should educators in EMS be practicing in either ambulance or the hospital? Oh, great question. We need the content knowledge, right? So we need to keep ourselves relevant in the clinical field. Do we need to be full-time practitioners? No, I don't think we do. But I do think that we need to be seeing patients. Now, if you're asking about the ambulance or the hospital, that's interesting. And I don't have a great answer for that. Again, because we don't have great research, and I'm not going to pretend to make up an answer that I don't know. What we do know for our students, and this has been kind of repeatedly shown in some data, is that hospital clinicals do not necessarily benefit student learning outcomes because hospitals do things so differently than we do in the field, that the only hospital clinical that's been consistently shown to benefit student learning outcomes is measured by obviously tests, is labor and delivery, because at the end of the day, a baby's coming out the way a baby's coming out. Like that practice, short of sending somebody to surgery, does not change hospital versus field, but everything else is so different. So my guess, by extrapolating, because that's all I can do, is that educators in EMS would better serve our students by being out in the field. That's strictly a guess. I don't have anything to back it up, but that would be my guess. Educators in Texas need to have an 8-hour per research cycle. And I love that. I love that they have to at least be on the ambulance ER. I'll be in Texas in a few weeks for your for the Texas EMS conference, or before Thanksgiving. Thank you. Looking for where one can pick up CEUs for teaching. I think this counts. Real, please let me know if I'm wrong, but this should pick up CEUs. It depends on where you're trying to submit your stuff to, if they require like CAPC accreditation, or if they just kind of accept whatever. I don't want to say whatever, but North Carolina was fairly lenient. So for example, if my program director or my dean signed off on something that I was doing, that usually worked. Certainly the NEMSI conference was kind of my first entrance into really getting any sort of educator professional development. If you teach at local colleges, some of them will have more education based, not necessarily EMS based, but so my college sometimes did things like, tips for online learning, or even as, how do you build your Moodle shell, or kind of those type of things. All of those make you better educators. Scrolling through what makes a great instructor, all the items. Yep. Your training never ends. My training never ends. That's why I went and got my doctorate. I don't necessarily recommend getting a doctorate in education for your professional development. It was what I chose, and there are many, many days I regret that, but certainly that's an option. Nurse educator. Yep. Nurse educator is kind of the only real path we have. And I don't know that it's not the wrong path, but man, we should be creating paths for our own. Linda, EMS educator career path. I am going to jot that down. I would love to know more about that. Anybody else is looking? Got to find a pen. Yeah, Linda, please feel free to share about the UMBC course, because I'd like to kind of reach out to them and pick their brains. Oh, there it is. You did that. I should just scroll down faster. Masters in Homeland Security. Yeah, I think any higher education is a great opportunity. The other thing that we know, and I didn't even really touch on, and I know people are probably need to drop and go, but when you don't have anything else to fall back on, you fall back on your experiences as a student. So simply having post-secondary education puts you ahead of the curve, because at least you have been taught in an adult setting, and you have something to fall back on. Until my doctorate, none of my degrees were in EMS or education. So an undergrad in psychology, a master's in psychology, and a master's in public health. I kept trying to get out and just got stuck. But I will say, if you have the opportunity for a bachelor's or a master's in education, or for those of us insane people that decided to go get our doctorates, I just soaked up the information, just soaked it in, because it was amazing. And again, I feel very grateful that I just didn't do any harm. And I stumbled across some really right things, but I wish I'd known this much sooner in my career. I appreciate everybody for being engaged. I'm happy to hang out for a few more minutes if there's other questions. Please don't hesitate to contact me. I'm very passionate about this topic, if you can't tell, and don't hesitate to give feedback. If there's things you would have seen or rather seen or done differently, or you thought that this was just garbage, I'm writing a dissertation. I have very thick skin right now. So I would love to know what I can do better or differently, or what more you guys want to hear about this.
Perfect. Thank you so much, Leah. We really appreciate the presentation. Like you said, we can definitely stick around and keep this open for a little bit longer if anybody has any more questions. Earlier in the chat, I dropped the link to register for the CEU, but if you missed that, that's totally okay. You will get that in tomorrow's follow-up email. I will make sure I put Leah's email address in there in case you missed that today. And I will also be sure to include the link to watch this on our YouTube channel. So thank you everybody for coming today, and we will see you all next time. Thank you.
Bo, are you down in the Louisiana area? I'm curious. I was just down there. Oh, I guess it's been a while now. I was down in January or February, working with Acadian. So I do some kind of other stuff besides just stand up here and talk about my research. It is very different. I love it though. My aunt used to live just outside of she lived in Mississippi, but she lived just outside of New Orleans. So I'm very fond of that area and the food and the people. Mostly the food. Well, the people too, but the food.
Does anybody have any other questions? No? Okay, are you good to wrap up, Leah? Is that okay?
Yeah, thanks. Thank you guys so much.
Awesome. Thank you so much. Have a good day.